Hi, this is Randy. I'm continuing on the sex addiction induced trauma model with dimension 10, relational trauma and attachment injuries. Sex addiction induced trauma impacts the partner or spouse, but SAIT also profoundly impacts the relationship as a separate third entity. The relationship, the us itself, is traumatized. The relational ruptures, attachment injuries, and relational disconnection and inability to reestablish healthy or even regulatory attachment becomes a source of traumatic experience. The lack of ability for reattachment creates an ensuing form of CPTSD, inducing conditions and symptoms, often resulting in traumatic reactive escalation or erosion and eventual loss of relational stability and basic dependency. Relational trauma in this context often causes significant symptoms of trauma and defensive coping adaptations in both partners. The sex-addicted induced relationship trauma and patterns of relational coping and disorientation is in itself a traumatic process involving myriads of injuries in dependency, trust, loss, grief, dissociation, and traumatic symptom sequences. The significant instability in each person and between each person is a source of trauma, as are the attempts for reattachment with chronic or pervasive failure. The heart of the relationship is often shattered and is hemorrhaging, and according to the model, requires immediate clinical assessment, stabilization, and the couple needs clinical intervention around safety and functionality. This is explicitly not couples therapy in any way. The traditional sex addictions model of stay on your side of the street for couples is often harmful, says Minwala. He said that in 2012. The degree of relational disturbance, attachment rupture, and relational trauma will dictate the first phase of clinical needs for the coupleship or relationship. The sexual addiction-induced trauma model asserts a systemic and relational model between the partner, the sex acting out partner, and the relationship. Dimension 11 is called family, communal, and social injuries. While trauma impacts a partner's interior world and primary adult attachment, it also has far-reaching implications for other relationships, including the parent-child bond, the social world, the experiences of being in public, the sense of communities that provide stabilization and dependency, and relationships to others in general and all human beings. It is common for many of these, often extremely painful dynamics, to go unacknowledged and excluded from discussions on sex addiction. However, these consequences on social functioning and interpersonal functioning can be a significant source of trauma and may involve multiple attachment injuries, significant grief and loss over many relationships, and profound, sudden, and prolonged shifts and alterations in the ways a partner relates to other human beings on the most basic level. Sex addiction-induced trauma impacts children. To have relationships impacted, such as the mother-child bond, the family, the home invaded, or for any parent to bear witness to the profound traumatic impacts on a child, children, or a family system is trauma-inducing for a partner. These losses of realities and the ongoing reality of others being impacted and harmed will no doubt provoke deep instinctive reactions and biologically based protective parental or maternal instincts and reactivity, as often reflected in nature, Example, the mama bear and the hornet's nest. Extreme rage may be expected when one's home, children, or family system is threatened and altered outside of planned intent. For a partner to witness her young children having trauma symptoms due to sexual acting out in the family system, even in the midst of recovery, can often be a reminder and a significant source of traumatic re-experiencing, inducing episodes of rage, for example. Often a family system is invariably impacted by sex addiction. Partners may end up holding secrets from loved ones and family, experiencing a loss of integrity with others she had always cherished before. Partners may lose friends, may find out their friends colluded and also violated her. The trauma may also cause social constriction and avoidance, causing significant changes to how the partner relates to her social reality, community, her public space, and to human beings in general, including agoraphobic symptomatology or loss of faith in humanity. Oh my gosh. And isn't that what I also talk about? Damn. That narcissist just gave me the gift that just keeps on giving. Dimension 12, treatment-induced trauma. The term treatment-induced trauma was formulated and articulated by Dr. Omar Minwalla in 2011, recently, to describe symptoms being presented in clinical context among partners and spouses impacted by sex addiction. Treatment-induced trauma involves both the induction of trauma and the traumatic symptom sequences experienced by the partner or spouse. Treatment-induced trauma is a clinical or medical intervention which causes harm, a parallel re-injury to the patient or client, and the traumatic consequences that ensue from the clinical interventions or serious clinical omissions perpetrated by therapists and medical professionals. Treatment-induced trauma is another trauma-inducing critical injury of SAIT. Often this dimension of trauma is caused by clinical interventions that are fundamentally organized around the traditional co-sex addiction model by Carnes in 1991, and I have a book by Carnes here sitting on my nightstand. The clinical interventions that are harmful are also fundamentally organized around a single concept codependency model. Oh, duh, the CODA model. Oh, what a surprise. And other traditional interventions such as sex-positive therapy, based in the omission of recognizing or treating SAIT among partners. Many sex-positive counselors and educators will prescribe date nights or sex nights for traumatized and sexually abused partners and couples impacted by SAIT, for example. Great. That's all I needed was a date night or a sex night. To reach out for help and be let down or let go or hurt instead of helped is of the utmost of serious violations in both medicine and human ethics and attachment relationships. To do no harm is what the medical profession takes an oath to do. It is the serious diagnostic mislabeling of well-established trauma symptoms, both CPTSD and PTSD, as an addiction based in core wounds and propagated by a foundational psychology of gender-based violence inherent in the model that causes and inflicts damage and trauma to not only the partner but also the addict, the couple, the children, the family system, and society at large. In fact, the traditional sex addiction treatment model, which promotes co-sex addiction as a primary clinical diagnosis and clinical paradigm for treating partners, is a collusion with perpetration that is harmonious with the exact perpetration of the sex addict and sex addiction, and is considered a specific subcategory of Dimension 7, the sex addiction-induced perpetration. Man, don't you get this, people? Indeed, this may often present among the first concern that may need to be clinically addressed and stabilized in order to access other SAIT trauma experiences in the service of optimal treatment opportunities for the intimate partner or spouse. Dimension 13. Spiritual and existential trauma. One healthy dependency relationship for the human psyche, indeed an archetype of connection, is with the universe, God, that which is beyond self or ego. This capacity for an established connection to transpersonal energy serves as vital stabilization for many people, including many partners. The vital relationship to that which is beyond or transpersonal, and that which supports us and protects us, the divine systems of meaning, can be impacted by this specific type of structural ego reality damage and injury. Indeed, existential trauma or spiritual trauma is a form of ego fragmentation, possibly representing a foundational structure on which much of the psyche may be organized. The traumatic shattering of a person's existential reality and their relationship with divine systems of benevolence or protection can be altered. And thank God I went into the opposite direction. I went toward the benevolence and the divine protection. That's all I had. This can result in ego destabilization, ruptures with benevolent or omnipotent attachment, and core psychic reliance on God, faith, humanity, love, and life itself. And I did lose faith in humanity. Foundational components of spiritual conceptualization and meaning may be significantly altered. To the extent that spirituality, religion, faith, and existential factors impact and relate to our experience and hold us up ultimately, is the extent that a partner may be traumatized by SAIT on this dimension and fall and collapse deep within her soul. That is the end of the article. Thank you so much for listening. As now it has been specifically explained, the depth of repetitive kinds of trauma that are experienced all the way from the discovery phase to the spiritual phase, and that it does not end when you find out something weird about your partner that just isn't right. That's just where it starts. It doesn't end until you're fully recovered and you're not experiencing any of these symptoms that I mentioned. Obviously, this process takes years, and when someone wants to tell you, oh, just get over it, you can tell them where to go. Thanks for listening.